am actually speaking from New York City. Let's see. There, you can see out this window. In a hotel on 11th Street. So, I've just had a blessing to spend 4 days with my teacher, Jeffrey Ewan, and in that period of time, we've been studying essential oils and how to use essential oils in the treatment of illness, and also looking at using for emotional issues or psychological issues as well as spiritual issues. Well, thank you for saying hi from Brazil, Daniel. I'm going to start talking tonight, and we're going to talk a little bit about post-COVID syndrome. And I'm hoping that many of you who are here have not experienced COVID firsthand, but I'm sure, like most of us, all of us have experienced friends or loved ones. I feel blessed because my 91-year-old mother was actually exposed to COVID 4 times and never contracted it. And we still don't know what there was about her that didn't get COVID when she was exposed so many times. But I'm going to start off, and part of this is to go back to the talks that we did earlier. And I had spoken, earlier in the year last, I guess it was probably, sometimes in the summer or in the fall, when I started talking with patients and friends about COVID and what we could do to try and keep ourselves as healthy as possible. It's interesting because today at lunchtime, my friends and I, we went back and we looked at the CDC, and we looked at, in March of 2020, they actually released an email suggesting that we didn't need to wear a mask. And that shifted quite soon after that, but probably not soon enough for many people when we hear something like that from the Centers for Disease Control of the United States. But since I've never made a mistake, I'm probably not going to holler too much at them at this point. What I want to start off is tying together those things that we talked about last time and the concerns that we had looking at COVID and how it was impacting what we would call actually chi stasis and blood stasis, okay? All of the information that we were seeing about the blood clots and how that was basically a part of Chinese medicine and could be predicted actually from knowing the person and their constitution and looking at them. So that was a big thing. But I think before I start this, what I want to do is talk a little bit, because a lot of this tonight is going to be based on just general theory and the theory of herbal medicine and how that ties in with Chinese medicine. And one of the things is the oldest herb book we have was called Shin Nong's Bin Sao. And at a certain point, they only talked about 3 grades of herbs. And the upper grade was considered herbs that were for longevity. It was considered health promotion. It was considered preventative medicine. And so if we look at the most important herbs, actually, are those that can promote longevity and basically help to prevent us from basically acquiring illnesses. The middle grade herbs were restorative. They oftentimes were based on one's temperament, and it had to do with being able to know, who am I? And, if I know who I am and what my issues are, then I'm also going to know what type of illnesses I'm going to be more, aligned with, okay? And the last grade of herbs was lower grade. And those were the herbs that were considered for treatment of disease. And so they were considered lower grade herbs because they were working with treatment of disease rather than longevity and health promotion. So we've been hearing a lot about post-COVID syndrome lately. And in looking at post-COVID syndrome, I'm just going to run through some of the symptoms that are showing up with patients, and we're going to just look at those from a Chinese medicine perspective, because I think if we can start pulling in that communication, it will help. Well, the first one we know is people are having more and more fatigue, okay? Instead of getting better and the fatigue, they may have gotten better right after the initial outbreak, but then the fatigue sets in. And that's just what we would call qi deficiency. That's not anything that most of you probably haven't heard. Oh, I have deficient kidney qi, or my lung qi, or spleen qi. And again, if you're new to this, remembering when you're hearing me say lung, I'm not just talking about the organ of the lung, but I'm talking about a whole energetic system. I'm talking about the yin of the lung and how it communicates with its jiang pair, the large intestine. I'm also talking about the emotion tied in with the lung. And sometimes emotion that can injure the lung is grief. So if you had a death in your family, you might be in a situation where you're really holding on still to a lot of grief. And that actually suppresses the lungs' qi and puts you at more risk of, basically catching something, whatever that something is that's going around. So that's just qi deficiency. The thing we're hearing a lot about is the brain fog and the difficulty thinking and concentrating. So one of the things I want to share with you, in Chinese medicine, we have had a diagnosis called phlegm misting the mind for thousands of years. This is nothing new. It's just, and because we have this, we can see that, this is one of the things that's happening after having this illness. So this phlegm misting the mind, which is difficulty thinking or concentrating, and probably all of us have heard now about people who may be having some severe psychological issues and maybe severe anxiety or some, not, the other diagnosis outside of that would be phlegm heat harassing the heart. So if you remember in Chinese medicine, the heart is basically the master of the mind. The brain is not the most important thing, but it is our heart that gives the energy to the brain. So if there's phlegm heat harassing the heart, so you could be having some psychoses. At the same time, you could have some blood stasis that could be creating some other physiological symptoms. So it wouldn't just be the psychological. So, phlegm heat or any kind of blood stasis could impact the mental status and also the physiological. The difficulty of breathing, we talk about in Chinese medicine, it's not just that we have to be able to breathe in, but that breath has to descend. And we talk about it descending in the kidneys, energetically grasping and holding on to this breath. And so if we're having weakness in breathing, sometimes it's not because the lungs are weak in taking the pulses, but it's because there's a blockage, there's an energetic blockage that keeps us from being able to get good breath. The painful joints and muscles are another thing. The chest pain, that comes from blood stagnation. I mentioned depression and anxiety, headaches, fever, palpitations, loss of smell or taste, and dizziness. And then the post-exertional malaise. In other words, you get better, you feel fine until you get up and go to work for a day, and then all of a sudden you feel like you've had a setback and you need to stay home again for a couple of days. So all of these are the symptoms that we're talking about in long COVID. And they are now suggesting that this is going to be creating maybe another health crisis, even after most people are no longer, no longer catching it. It's still happening. We know at this point there are places in the United States that are really, at this point in time, still having extreme outbreaks. And someone just posted about tachycardia. Well, tachycardia is a type of palpitations, okay? It's a fast heart rate. And yes, I've seen atrial fib, I've seen tachycardia. All of these are part of this, and it has to do with heat impacting the heart. And so when I say it like that, if you try and take it and put it into a Western medicine box, it's really not going to make much sense to you. So I'm going to be trying to give a little bit more information for the people who are not practitioners, which might make it a little boring for those of you who are practitioners on here. But for us, there are enough of our patients who are attending this that we really need to make it so they can understand also. So what we're going to be doing is looking at, what happens after you've had COVID, and what are the things that you can do to ensure that you're not one of those 1 in 3 patients who end up with post-COVID syndrome, or long COVID as they're calling it. They're saying now that 30 to 40% of COVID survivors are going to have a post-COVID syndrome. So that's a pretty big gap of people, a pretty big group of people. So if we know how to address this, then it's going to make a big difference for everybody. So, in looking at the post-COVID, one of the things that's happened is that, we're sitting here looking at, getting, well, here in the United States, only 1 of 3 vaccinations, okay? And for people who are getting the vaccine, they've asked me which one I recommend, and it's really hard. I know that the Johnson is antiviral, and the Moderna and Pfizer are off, both are the ones that impact the DNA and RNA, but I don't think we have enough research at this point to know for sure. But in looking at everything that happens when one of us gets sick, we have to start looking at what pathogenic factors are. And there are our internal pathogenic factors and our external. So I'm first going to run through the external because that's going to be very quickly. And we know that if we are outside and we get overheated, we're playing tennis, that we could have a heat stroke. So right off the bat, heat can be a pathogenic factor that impacts us negatively. Cold can also be a pathogenic factor. We talk oftentimes about cold lodging in the uterus if people are actually swimming during their menstrual cycle. And I can remember hearing things like that when I was a kid, and I thought, oh, well, that's just crazy. That's an old wives' tale. But now that I'm older, I see that cold not only lodges in the uterus sometimes, but it can also lodge in the joints and create a lot of problems with arthralgias. Another thing that creates problems is wind. Now, we're seeing a lot of wind symptomology with post-COVID. Wind symptomology can be nothing but just a little tremor of your hand, or it could be severe dizziness, okay? But those are symptoms that are pretty strong for a lot of people with post-COVID. The most extreme of that, of course, would be a grand mal seizure. And we don't see that as much, but that has also been, one of the things that has occurred with post-COVID. So we're looking at wind, we're looking at cold weather, we're looking at the heat. We're also looking at summer heat. And when we start talking about summer heat, we're talking about 2 factors. We're talking about heat, and where I grew up in Louisiana, we're talking about damp heat. That's the muggy, damp, heavy heat that we experience, okay? So that's also considered a pathogenic factor. Another thing that we don't have to worry very much about in Asheville, but for those of you who might be living out in New Mexico, is the dryness. Extreme dryness in the environment can also create some issues where a person has what we call yin insufficiency, and that becomes very important in post-COVID syndrome. So I'm going to be talking about dryness and dampness are going to be 2 of the factors I discuss the most, because that has to do with the medium of both fluids in our body, and those are fluids, whether they're the thin fluids like our sweat, the thick fluids having to do with hormones, or also the dryness that comes from being in a situation where you don't have enough fluids, because all of these can really create a bigger and more deeper problem, with illness. So one of the things that, when we get to talking in a few minutes about that, one of the things that we talked about before was how the organ systems were affected. And I think what I'd like to do right now is just run through that again as a really quick factor, because we've talked about I left out one thing. We talked about the external pathogenic factors from our environment, but we didn't talk about the internal pathogenic factors. And those internal pathogenic factors are the things that we have control over. And so anytime we have an illness, it's not just the pathogen, but it's also, what do I bring to that? What is happening with my body? If I've been working 80 hours a week, then I'm going to have some exhaustion. So I'm going to have some chi deficiency right off the bat. So how rested I am is going to impact how an illness impacts me, okay? The other thing is stress levels. If you're under tremendous amounts of stress, maybe your parents have been sick and you've been caring for them, or you have a sick child and you're caring for them. But all of the stressors in our life also are going to impact how much resistance we have to not just COVID, but also to post-COVID. So we're going to be talking about the internal pathogenic factors. And each of us has a place that we may go to more whenever we're having difficulty. Some of us may be really quiet and get really sad, may get depressed. Some of us get angry. Some of us just obsess and worry all the time. So, some of us have fear, and fear has been what's mediated a lot of the last year. I mean, there's been a tremendous amount of fear, and it seems like there's that combination of fear for some people, and then some people are just being in a place where they would like to pretend that this wasn't happening. And so the strife it created in our country has also played a very big part, I think, on, not the who got the illness, but how we responded to it. If you had a lot of worry and what we would call some imbalances mediated by doubtness, and you got an illness, it might linger a lot longer. If you were angry all the time and had a tremendous amount of heat, it might be that if you got it, you would run a much higher fever because of this. So you've got the external pathogenic factors that have to do with what's happening in the world and the weather, and then we also have the internal pathogenic factors that has to do with our lifestyle, what we're eating, what we're thinking, how we're moving through life on a day-to-day basis. Are we getting plenty of rest? And or we're taking care of ourselves to where we're getting some activity every day. All of those are those internal pathogenic factors. And it's not just the external pathogenic factor. It's not just the virus that basically determines our illness, but we've got to take the virus and look at who we are as individuals. And those two together tell us how we're going to meet this virus and how we're going to do, or how we're going to move through post-COVID. So we've been looking at the organs that are affected by COVID. And in Chinese medicine, as soon as we started seeing that it was blood clots and blood vessel problems, for those of you who are coming into my office, you see now that when I look at your tongue, I'm not just looking at the top of your tongue, but I'm usually looking at the status of those two blood vessels that are on the bottom of our tongue, because that also illustrates something about our health and about the status of blood. The other thing that illustrates about the status of blood are the pulses. There are specific pulses that show us that there may be an imbalance. It could be a wiry or tight pulse showing us that blood may not be moving as smoothly, and we could have higher levels of cholesterol because we are also having a phlegm along with blood. Now the interesting thing is the minute we hear about cholesterol, everybody starts saying, oh, well, you need to change your diet. Well, I need to tell you, you need to go research this, because the amount of cholesterol that you eat only determines 5 to 10% of the cholesterol that you're getting that reading from. So if you're getting a reading of 250 or 300, that's not always due to what you're eating. Again, what you eat determines a small amount of your cholesterol. That has to do with a lot of other hormonal factors, and it also has to do with the balance between your liver and your gallbladder and all of the organs that are tied in with the hormonal system and tied in with, the fluid systems of our body, not just blood, but the fluids, in other words, dampness. So if we're looking at COVID-19, we know it created more blood clots. So anybody that we saw who had more blood stasis, right off the bat in my office, we were changing their herbs and maybe adding in something having to do with blood stasis, where we were activating blood flow. Because if someone has blood stasis, we knew that they would have more severe symptomology. So you took pulses if there was a problem with, if you were seeing a choppy pulse, for those of you who are practitioners, or you were seeing tight pulses or wiry pulses, we generally would add in some chi movers or some herbs that moved blood. So we were looking at, the heart. And when they're talking now about heart failure, they're not just talking about blood stasis, but they're talking about phlegm and blood stasis. The lungs, the type of pneumonia that's associated with COVID usually creates long-standing problems, with the tiny air sacs in our lungs. And that leads to scar tissue that basically creates more problems with breathing. Even in young people, the brain has created some problems, neurological problems, stroke, seizures, or Guillain-Barré. COVID-19, they've seen, increases our risk of developing Parkinson's, which is oftentimes a disease where there's a strong wind, and even Alzheimer's. So, right off the bat, we could see from a Western perspective it impacted those. But then as time went on, we started seeing that it also had to do more with, also with the kidney, that people who ended up having problems with their kidneys while they were in the hospital with COVID had a much harder time than people who may have had some kidney problems that were not related to COVID. I think the thing that's got most of us worried, though, is all of the manifestation of the brain-related after effects of COVID-19. There's been, as I mentioned early, brain fog, there's the memory loss, and there's neurological problems, but there's also psychoses and vascular issues that are occurring. And so I think that's really been a pretty, it's created a lot of anxiety for many people. And particularly because they're seeing that the psychotic symptoms can emerge weeks or even a month or so after the people have had COVID, even though they may have never had any psychiatric illnesses in the past. Just because you have to remember that when someone ends up with a psychiatric issue here, it's not necessarily related to them having a long history of mental, emotional issues. There's been some information showing that once people had the vaccination, that maybe they had some post-COVID symptoms that did resolve. And I think that we can trust that that's happening. And I'm a little concerned about that because we talk in Chinese medicine a lot about things becoming latent, or we have a residual pathogenic factor. We have a pathogenic factor that's still, it's basically like we've taken it and put a little cover over it. It's not like it's gone, but it's not giving us a lot of symptoms at this point in time. And, I've talked about this before with maybe children who have one round of antibiotics after another for, say, ear infections. I've seen children in my life that would have, 10 to 12 rounds of antibiotics every year for ear infections. And what we talk about is that basically the antibiotics basically keep it latent. And I think what we're starting to see is with COVID-19 that, sometimes people don't have the ability to clear it completely. And if we can't clear it completely, oftentimes or sometimes our body will make it latent. And there are specific pulses in Chinese medicine that tell us whether something has become latent. There's hidden pulses, or if your pulses are very deep, that we'll see sometimes that latency is occurring. And these are the things that I think Chinese medicine is really good at working with. Once we start looking at, someone's had COVID, they're now at a place to where they've recovered, and, we have to look at, what's the likelihood. We're seeing 30 to 40%. But what I'm hopefully going to do is give you some things tonight that you can share with your friends or your family who have had COVID. Because I think one of the things that we see is if people have what we would call yin insufficiency, and I'm just going to tell you, yin insufficiency has to do with fluids. So it has to do with the thin fluids, like I said, saliva, the thin fluids inside our body and outside, the thick fluids, the hormones, the marrow, in the spinal cord, the thick fluids. And then also, besides that, it has to do with blood. So we have all of these fluids. And if we have a place where the body doesn't have sufficient fluids to get rid of something, then oftentimes it will go latent. So if you have a lot of dryness and a very dry, hacky cough, we would say that's because of some yin insufficiency. So what we want to be able to do is to be able to basically boost our yin. Right off the bat, for Americans, sometimes that means looking at the foods that we eat that may basically deplete yin. And so anytime you're really, really sick, you don't want to be eating like really hot, spicy foods. Now, when I say that, I'm not talking about spicy, like fresh ginger, and even kudzu root. These things help our body to be able to release the exterior we talk about, and maybe promote a sweat to be able to let go of maybe a bacterial or a viral infection. But what we don't want to do is have so much dryness that we have dryness in our lungs, we have dryness in our colon, and maybe we're not urinating enough, and so we just need more fluids. And unfortunately, just drinking a gallon of water a day does not create a strong yin. That's one aspect of it. But if we have a tremendous amount of heat in our bodies and we're drinking water, it's kind of like, imagine you put a pot on the stove with no fire under it, and you put a pot on the stove with a lot of fire, and then even as you're drinking fluids, they're being dried up if you have an internally hot nature. And when I say hot nature, we know what that means. Those are the people who are hollering all the time when they're talking. Those are the people who, maybe are quick to anger or quick for any emotion. So, it's yin deficiency or fluid insufficiency impacts the blood also, because a large part of our blood is those yin fluids. It's not just the red substance. So we look at what we have to do to basically help someone recover. And like right now, I'm just going to look more at post-COVID. We're going to assume that hopefully your friends are still not getting COVID. Of course, that's really not a good assumption right now, because we know that people are still coming down with COVID every day. And it's not just the virus, which I was talking about earlier, that impacts whether you become very ill. It has to do with what's the health of your body when you get it. We've seen that people with diabetes and people who are obese have a more difficult time. Where in Chinese medicine, diabetes relates to the health of the spleen and stomach, the pancreas, and the foods that we're eating, and how good that our pancreas is able to secrete insulin. And so in Chinese medicine, the pancreas is considered a part of the spleen. So those groups already have some problem with fluids. And we talk about someone who's obese as having an a accumulation of phlegm. Okay, so you could refer to fat as solid phlegm. It doesn't sound very attractive, but that's what we would refer to that as from a Chinese medicine perspective. So if someone already has an accumulation of phlegm or dampness or inability to basically their body, the spleen and pancreas, to secrete insulin, and they're already having to use pharmaceuticals for that, they're going to have more of a problem getting through COVID. Whereas someone who may be real healthy, and that's mostly young children, okay? They haven't had the years that I've had to go ahead and build up some latency here or there for things that I haven't handled through the ages. And we are all at that point, at some point in our life, except for those of you who are just perfectly healthy because you've lived a great life and taken care of yourself. But people ask about how fast you can recover, and how fast you heal often has to do with the taxation that are already on your organs. If your acupuncturist has told you have deficiency of kidney qi or deficiency of spleen qi, then those are the organs that maybe already have a little taxation to them. Or they've told me, that you have a deficiency of yin or yang. You have taxation on your entire body because of yin being deficient or yang being deficient. There's this formula that I'm going to actually tell you about, and I'm going to actually, Jen, see if you can write this down. I just realized I can type it down. Will everybody be able to see this? I'm going to type in the name of a formula, because this formula is something that's basically used all over China and all over Asia for recovery. And the three words in it, Qing, means to clear pores and clear heat, okay? The second one, Bu, means to nourish, okay? And that's to nourish fluid and nourish blood. And Liang has to do with resolving dampness. So I'm going to type up this formula later and put it up at the end. But, this is a formula that they're saying helps to basically resolve, again, it's a general formula for people who are extremely fatigued and having problems with post-COVID. So all of all of COVID is going to have some problems with fluid and with blood. And so there are a lot of different herbs in here that actually help with that, like lily bulb is one. The other one is a lotus seed. There's what's it called? Chanel dioscorea. There's red dates. There's a fruit that it nourishes blood and particularly nourishes heart blood. And there's also bitter almond that helps to with the lungs. So it's a formula that you could even drink as a tea, and it's not going to taste horrible, except that all Chinese herbs basically taste horrible. You can't take a bunch of leaves, twigs, and sticks and boil it up. And, even putting in this formula, there's two different fruits in there, longan fruit and red dates. And that's not enough to make the rest of it taste okay. But it's not a real bitter tea because it's nourishing. It's nourishing fluids, nourishing blood. So it's a nourishing formula to take if someone has post-COVID syndrome. And the big thing is, one of the best things to do with this is to not worry about drinking the tea, but take all of these ingredients and put it in a soup and cook yourself a vegetable soup or a chicken soup where you can be eating it every day. And that will, and when someone's sick and you're trying to eat food to basically help them, it's not about having a serving of it. It's about eating it 3 times a day. There's no reason why you can't eat a soup in the morning and at lunch and dinner and have some other things too. But this is a medicine that's being cooked into a soup, and it won't the soup will still taste good. It's not like it's going to be real bitter, because like I said, most of these are tonic herbs. So I'm going to write that and put that up on the someone just asked how it differs from Chihutang. It differs tremendously because Chihutang is a harmonizing formula. It's not really a tonic, and this other is a tonic formula. But before we talk about how to get well, we have to look at the things that can be obstacles to our recovery. So you've had COVID, you've gotten better, but you're still not getting well all the way. So let's talk about, risk factors, usually if we're sick or not eating properly, okay? And it's like if you have a lot of problems already with diabetes, high blood pressure, all of these things, it's going to make it harder to eliminate that pathogenic factor because you're already on a lot of pharmaceuticals. And how do we bridge the current condition, the COVID, with the underlying condition in your body? So that has to do with knowing, where are your weak points? Where are your strengths, okay? If every time you get any respiratory infection, and besides having a cough, you're always having low back pain with it, then you probably know there's a little bit of kidney deficiency. Or if you're always getting a little bit of urinary tract infections, no matter what's going on with COVID, there's 2 things. There's the branch treatment, which is the COVID. You've caught COVID now. But then there's the root that we have to look at. What was your constitution before? Where were your strengths and where are your weaknesses? And so if your practitioner knows which of your systems are the strongest, they're going to try to activate those to help get rid of the pathogenic factor. And so it's always in Chinese medicine of how much do you treat the root, okay, which is who we are, and then the branch, the illness that we've basically come upon. And again, the obstacles for those have to do with our lifestyle. How many people basically get sick and miss a week of work, and come Monday, they're still so weak that they can hardly stand up and walk out to their car and drive to work and walk in, but they go to work because they're not running a fever anymore. It is absolutely essential that you rest until past the point that you feel like you should be going to work, because we tend to jump too quickly to that in our culture. So I'm going to suggest that rest is going to be number 1, okay? Outside of resting, it's also looking at, again, what you're eating. if you already have problems with, if you've seen an acupuncturist and they tell you that you have a lot of dampness, then you've got to eliminate all of those foods that continue to impact dampness, particularly during COVID. So you eliminate milk, cheese, yogurt, ice cream. Most of the yogurt you buy in the store doesn't have enough probiotics to impact you positively anyway. If you need probiotics, you really need to go to the place in the store that sells the refrigerated probiotics and get those and take them. Don't think that because you're eating yogurt from Dannon that you're getting the probiotics that are going to help you with the yeast infection you've had for years. That just continues to aggravate it more and more. So, so milk, cheese, yogurt, ice cream. If you're having problems with dampness, you have to eliminate that. And we know that dampness is a big issue because what's one of the first issues that people get? It's sensory orifice blockage. If your nose is blocked and you can't smell and you can't taste, then we need to be, first of all, looking at opening up the sensory orifices. Because the sense of smell goes directly into the brain. And it's the one sensory orifice we have that has that direct connection to the brain. So I'm also going to be suggesting that essential oils are one of the better ways to treat post-COVID symptom. And I'm just going to tell you right now, if you have, if you do not have a good sense of smell, it's one of the best things that you need to work on for longevity and for improving your health. And because this blocks our sensory orifices, of course, we're going to have more psychological, neurological problems. And we talked about that before a year ago when I was talking about COVID and how to, look at that and to basically be able to move through it. And so right off the bat, anything that creates, more sinus issues, you've got to resolve those so you're not dealing with COVID symptomology on top of already having chronic sinus issues. There can be factors where you can have a recovery process that you really don't get this chance. I mean, like, there's such a quick incubation for Ebola that basically by the time you've been diagnosed with Ebola, you really don't have much of a chance for recovery. But that's not the case at all with COVID. It can lead to chronic inflammation and chronic degeneration, but those things are usually viral, bacterial, and fungal where we get these chronic conditions. And herbally, you can resolve all of those. Essential oils can help too. And so you can speak with your practitioner. And the nice thing is that we just had a big workshop this weekend and talked a lot about sensory orifice blockages for those students who are here. The chronic conditions that are caused by these viral, bacterial, and fungal taxation is chronic cystitis, chronic gastritis, H. pylori. There's so many things, chronic urinary tract infections, chronic sinus infections. All of these chronic conditions are showing us that we either have a viral, bacterial, but most often a fungal taxation on our body. So those are the things that we want to look at resolving now, because by resolving those things that are taxing on us now, we would be healthier if we did basically end up with COVID and be able to resolve it quickly. We talk about, I've talked about latency, and the things that make viral conditions and bacterial infections latent is dampness. So that is, from my perspective, the most important factor for us to address also when we're looking at the post-viral conditions or the post-COVID. Let's see. We talk about there being three kinds of stagnation. There's chi stagnation, there's blood stagnation, and those are the blood clots we've talked about, but there's also food and phlegm stagnation. And any one of those can create problems. But when you have phlegm stagnation and it basically impacts blood and chi, then it makes it a much more serious condition. So I'm going to really suggest that you pay attention to that, because those are the things that create latency in our body. And when we have something that's latent, it's going to create a problem where we're going to have long-term symptoms that get a little bit better and then get worse again, better and worse. And that's latency, and oftentimes that's been mediated by dampness. In looking at the foods, I think I'm going to go ahead and type in this formula really quick, and then let's see. You're going to have to find some, there's a lot of acupuncturists on this, so this is a formula that all of you could basically, oh man, I've got to type it all in one. You can see I do this a lot. That's that's half of the formula. Yiren, Shan Yao, Dad Zhao. And again, this is a formula that can be put in a soup. So it makes your entire family healthier. Okay, so Yudza, Baihe, Lianza, Shashin, that would be Bei Shashin, not Nan Shanshin. Ba Mao Gen, thank you for someone doing that. Yi Rin Shan Yao, Dad Zhao, that's not Zhu, but Dad Zhao, Z-A-O, and Long Yan Ru and Xing Rin. Every acupuncturist who's watching this knows these herbs, and these are easy to get. And the nice thing about these herbs is they nourish fluids, because whenever we have a situation where we're dry, it's harder to get rid of a pathogenic factor. So I'm going to suggest that, all of the things we've talked about, you drink fluids, you make sure you're drinking fluids, but you also have to look at how many cups of tea are you drinking a day, because tea is a diuretic. And also, besides tea being a diuretic, coffee is a diuretic. So every time you're drinking a cup of coffee, it means you just lost 2 cups of fluid. So you need to be drinking a couple of cups of water for every time you're drinking coffee or tea. Oftentimes people, when they get real sick, they'll say, I just want to get back to the way I was. And I want to remind you that the way you was, even green tea, yes. The way you were is what brought you here. And we don't really want to go back to the way we were, because then we're still on the same path. We want to look at how can we walk, and we've met you've got a road maybe you haven't traveled before, where you go to make some changes. So I'm going to really strongly suggest that people don't look at going back to the way it was, but that we find a new path. So I'm going to look through these questions real quick. Herbal teas are fine. They're not diuretics. Black tea, coffee, green teas, all of those are diuretics. Let's see, I saw some questions. Someone asked, in regards to blood stasis with post-COVID syndrome, would you recommend the client remove her IUD? Depending on how long she's had her IUD in, there could be a big adjustment period there. So I think that would have to be individually addressed, and you'd have to be able to evaluate your patient. See what's the status of blood, what's the status of their body to basically not have some problems with the next couple of menstrual cycles. If they were bleeding so excessively and it wasn't just used for birth control, then that might create more problems. But if not, I mean, I generally recommend now that women use cervical caps rather than IUDs for birth control. Just do you recommend that people take the vaccine or not? And if so, which vaccine do you recommend? Oh man, isn't that the question for everybody? Do you recommend it? Should you wait until you're feeling completely well before you take the vaccine? There's some, again, we've seen that some people get feeling better quickly if they take the vaccine, even when they still have some symptoms. So it's a hard thing to decide whether you're going to take the vaccine when you're not completely well. I would generally recommend that you always are well before you take a vaccination. The things that we've recommended for people to take if they're going to do a vaccination is either Chihutang or San, depending on the person. And your own practitioner should be able to tell you if Chihutang would be better, that's Majebé, or Yin would be better for you. But I recommend that people take it the day before the vaccine, the day of, and the day after. And I recommend that people get acupuncture treatment the day they have a vaccine if they take it. I've heard people talking about the Johnson & Johnson is at least an antiviral. I would probably tend to think about that, but all of them have their side effects. All of these have something that it's not just because of the RNA DNA connection, because even the Johnson & Johnson's creating some blood stasis. So from a Chinese medicine perspective, what can we do to help with blood stasis? Get up off of our booties and walk. And let me tell you that the biggest issue I think that we have going on in our country is that people are being told that running and jogging is good for your health. And the man that wrote the book Jog for America, or the name of that jogging book, also died of a cardiac event, had a heart attack. And I hate to, say that because he was trying to get people up and moving. But the truth is, what we need to be doing is walking. And we've got too much stress in our lives. It's not like, we are sitting around and just going out for hunting and killing our food, and the rest of the day that we're sitting and talking with family. We're gone and running at 100 miles an hour all the time. And so I'm going to suggest that everyone start walking, that's one of the best things. If you had COVID before, is there any reason to get the vaccine? The CDC would say, absolutely, you should still get the vaccine. Let's see. So you're asking me some things now that have to do with a paradigm that is not my paradigm. And, I wouldn't use, if you're someone who has always bridged Western and Eastern, then I'm going to say, well, then yes, go ahead and get the vaccination and, do the things to take care of yourself. Find an acupuncturist, so take Majebé or take Yin for the day before, the day after. How much do you trust the RNA vaccine? Is someone has a strong aversion to take it? Is it better not to take it and trust other precautions? I'm going to always tell you to follow your heart. I'm going to tell you to follow your heart on everything. So I think that all of us have to evaluate it for ourselves. And, you're going to have to decide, with you, looking at you, your family, what you feel is best. Should you treat for side effects if you've had the vaccine? Yes. What about jade screen? Well, jade screen is usually something to protect an invasion from coming in. It's got fong fing, baiju, and astragalus in it. So I don't think if you're having some side effects from the vaccine that jade screen is the right thing for you, unless the only side effect you're having is extreme exhaustion and you're just in bed all the time. And then you probably need a higher dose of Wang Chi in a formula anyway, that jade screen wouldn't be strong enough for you. Sensory orifice open related to post-COVID, loss of sense of smell. Yes, so this is what I'm going to tell you. And remember, there are a lot of different qualities of essential oils. Jennifer, type in Alchemica Botanica, Swiss Aromatics, SWISAROMATICS. If you're getting essential oils from either one of these places, I'm going to feel good about it. But maybe the only thing you have is what you got from Earth Fair, and it says it was organically grown, so you're really happy with that. But remember, it's not how they're just grown, but it's how they're extracted. And oftentimes, the less expensive essential oils are extracted with solvents. So please be very careful about hearing someone say, oh, you can take these internally too, because if you're going to be taking essential oils internally, you need to, first of all, know exactly what you're doing. And the second thing you need to know is who's sourcing your essential oils. Are they medical grade? And most of what's sold in the United States is not medical grade, okay? The reason you pay more for the essential oils at my office is because they're all medical grade. But maybe you're going to just use it for diffusing. And, you know, at nighttime, you could diffuse eucalyptus, and it could be any eucalyptus. If you had tremendous amounts of phlegm, you might want to use the Eucalyptus globulus, but you could also use Eucalyptus citrodura or Eucalyptus radiata. Okay, any of the eucalyptuses along with pine, because pine nourishes both the lungs and the kidney. And let's see, what else could and peppermint. So that would be a great thing to diffuse. But the other thing, all you have to do is put 5 drops of each one in a little bitty drown bottle. Put the lid on it really tight, and you don't put it up here and smell of it. That's not going to do it. What you want to do is almost snort it. You have to sniff it really strong because you want to get it to go directly into the brain, which it does, but you put it up and go, I mean, you really have to breathe in deep. And those are the things that will help to basically open up the sensory orifices. And then you look at what you're consuming that could be doing that. But from a Chinese medicine perspective, the Chihutang would be one of the things that would help to prevent latency, and also the yin chow. But the best thing is to see your acupuncturist. I know y'all live, some of you, I see my friends from overseas even on this. It's nice to see y'all, your little names at least. But, find an acupuncturist or a Chinese medicine herbalist, or, if you live someplace with the Western herbalist, or find someone who really knows essential oils, because, we can tell you things to make you strong, like the soup I gave you, but there's not one solution for everybody, okay? It has to do with your constitution. And if I took the same medicine that my friend Junie took for basically if we had COVID or post-viral COVID, we're very different energetically. And you have to have something that matches not just the disease, but who you are. And that's the biggest difference between Chinese medicine and Western medicine. Chinese medicine, Western medicine, you've got COVID. This is what you take, besides the good things that you're going to be taking, vitamin D3 and zinc. But this is what you take. They're treating a disease. And the minute you start taking just one thing or one set of to treat a disease, then you're no longer practicing Chinese medicine. Chinese medicine always has to take into effect what are your strengths and where are your weaknesses, and what do we do to help you find a place where you can be healthier, because we're looking at your constitution and how you can resolve from an illness rather than somebody else. Yeah, I have a inexpensive diffuser, and then I have some expensive diffusers. I would tell you right now to get even an inexpensive one and run it by your bed at night if you're having, even with the plastic inserts, because at least they're a harder plastic, but of course glass would be better, or wood, something that's not going to absorb it. Thank you so much. I am glad you joined us, and I hope you learned something tonight, and you can take it and create better health for you and your family. Have a good night. Bye-bye.